Carrie Kroll. I am the Senior Vice President of Advocacy and Public Policy for THA. I oversee our lobby and policy work.
Sarah Gonzalez. I am the Vice President of Advocacy and Public Policy at THA. I largely work on Medicaid, supplemental payments, also work on behavioral health, and I also run our Political Action Committee.
Will Holloman, I'm the VP of Advocacy and Public Policy. I cover areas ranging from public health, rural health. I cover issues on tax policies as well as some of the insurance coverage.
Benjamin Williams, and I am the Vice President of Advocacy and Public Policy at the Texas Hospital Association. Some of the things that I'm going to be working on are huge topics like behavioral health or pharmaceutical pricing in the 340B program. I'm going to be working on licensing and regulation of hospitals. I'll be working on another huge topic, which is workforce.
This session will be a little bit different as I step into this new role. We've got a new team in terms of THA, bringing on new people, brings on a new perspective, and certainly you have some of the old guard here that are well aware of how important the THA membership is, the focus on our vision, and the ability to work with our hospital advocates.
You know, each session is its own beast, and I think my favorite part of it though is still to take advocates up to the Capitol, get them engaged, talking with their members, talking with the staff, making sure that there's that connection at the local level so that when something does come up and they have a question, it's not just me they're advocating on behalf of those hospitals, it's somebody that they've met and they've interacted with and they have that connection to the local community.
What's happening over there is a big conversation about what policies we're going to have as a state moving forward. And when it comes to our hospitals, I want to make sure that the expertise and the knowledge and the idea of service is forefront in those conversations over at the Capitol.
We have had more turnover in the legislature over the last few cycles, and so that means kind of a lot more effort on educating. And so from our perspective, it's always, what can we do to make sure all of these members, new members and old members, know who we are and that you have access to us, that we want to be a resource, and that we certainly are going to do our very best to give them as much information as possible as they make these really difficult policy decisions in healthcare.
We will be doing our best to keep all of the priorities of the hospital industry, from the ability to financially exist and keep our doors open, to ensuring that when patients come to us, they're not coming for things that can be prevented or stopped. They're really there because they have an acute need, and we're the best place for them to receive that care.